See important safety information at the end of the video. Only your doctor can determine if this therapy is right for you.
Well, November is Diabetes Awareness Month, and according to the CDC, about 30% of the people with diabetes also suffer from diabetic peripheral neuropathy, or DPN, a progressive neurological disorder causing numbness or stabbing pain, most often in the legs or feet. Joining me now to discuss further and share some promising treatments are Dr. Silky Patel, an interventional spine, sports, and pain management physician in Houston, Texas, and Farrah Stewart, a patient who is being treated for this condition. Thank you both so much for joining me today.
Thank you for having us.
Thank you.
Now, first, doctor, tell us how prevalent is diabetic peripheral neuropathy, or DPN, and what are its causes?
Interestingly, it is actually quite prevalent. 3 in 10 patients who have diabetes experience DPN. What it feels like is a numbness or tingling that can start in your toes or feet and progress up your extremities. See, when you have diabetes, your blood sugar is actually quite high, and eventually that affects your nerves. So, over a prolonged period of time, the nerves get affected. And patients who are more likely to develop DPN are those who are prone to getting peripheral vascular disease and cardiovascular disease.
Now, Farrah, you were diagnosed with the painful DPN condition. Tell us, what has that experience been like for you?
So I was diagnosed with diabetes in 2018, and shortly after I started having symptoms of DPN. And the DPN symptoms were, as Dr. Patel stated, pretty classic textbook. It started with pain, numbness, and tingling in my toes that went to my foot, and then eventually started going up my legs. I'm a registered nurse, and I have a mom who also suffers from DPN, so I knew the symptoms, knew what to look out for, and what to report to my healthcare providers, which I did. DPN started affecting my life very significantly when I was unable to stand for long periods of time to do just regular everyday things, attend functions with my children at school, cook, clean, and eventually I had to stop working because of the pain and the tingling and numbness and just the symptoms that were, interfering with everyday life and regular things like sleeping.
Oh, wow. Thank you for sharing that. Now, you mentioned that it cost you to have to stop a lot of things. And we know, as being a parent, that can be quite stressful. How did you manage those emotions going through that and your mom daily duties?
Well, managing the emotions were difficult because I did go through a period of depression and anxiety. I developed anxiety during that time. The good thing is I have a very supportive husband, and I have older children who were able to help with my younger one at the time. But I mean, it's kind of difficult when you want to attend an event or you want to attend things, because I was a very active mom before, where I would chaperone and join everything they had at school, and it got to the point where I was unable to do that, so it was difficult.
Yes, thank you so much for sharing not only your journey, but everything you went through emotionally as well. And Dr. Patel, tell us, how is DPN being treated?
So unfortunately, there's no cure for DPN. However, there are ways to manage its symptoms. So when a patient is referred to me, I like to start with conservative measures such as compression stockings, physical therapy, oral medications. But when things like those don't work, as in Farrah's case, we like to turn to spinal cord stimulation, or SCS. SCS is a battery-powered device that lives in the back underneath your skin, and it blocks pain signals from getting from your spinal cord to your brain. The best thing about it is you can try it before you get it. So I tell my patients it's like test driving a car. Those who get spinal cord stimulation are actually 17 times more likely to achieve meaningful pain relief compared to those who are conservative medical management only. One study followed them out 5 years and found them still getting great pain relief. We are here today on behalf of Medtronic, who worked hard to get FDA approval for SCS to be able to treat DPN.
Yes, that's some good information to know because a lot of people may not even know that that option is available. So thank you for sharing that today. Now, Farrah, we talked a little bit about how DPN has affected your life in terms of motherhood. Tell us how the spinal cord stimulation has made a difference in your life, especially in fulfilling those mom duties.
So, spinal cord stimulator treatment made a huge difference when it came to being a mother and also career-wise. And I did have all the conservative measures that Dr. Patel spoke about, and those things they either didn't work long-term or they didn't work enough. And she suggested spinal cord stimulation, and I went through the trial period, which was about 5 days, where you wear the device externally, you go home, you perform tasks that you normally would perform, and you kind of make note or keep a diary of pain relief and how much pain relief you're having. And the device worked very well. So we moved along to getting the permanent implant, which I have a Medtronic Intellis device, and things are so much better than they were prior to me getting the spinal cord stimulator. I've been able to do more activities. I've been able to attend more things with my youngest daughter, with my older children. I've been traveling more, and I've gone back to teaching classes and being able to attend visits and appointments and meetings with clients. So it's made a tremendous difference in my life.
That's wonderful to hear, and especially with you being a registered nurse, you know how things can impact you or not impact you. Like you said, not everything works for everyone. So it's good to hear, coming from someone who has that background, that this is really a beneficial treatment for DPN. Now, Dr. Patel, what advice would you like to give to people suffering from painful DPN? How would they start that conversation with their physician?
Well, first of all, I would like to tell them not to give up hope because although there is no cure, the symptoms are actually quite manageable. So what they should do is find an interventional pain physician who can take that journey with them all the way from the conservative medical management, all the way through physical therapy. And then if those things don't work, to be able to talk to them about spinal cord stimulation or SCS, because not everybody is a candidate. However, if they can get implanted with SCS, is a great way to get back to living the life that they want to live.
Absolutely. And tell us, where can people go for more information about the spinal cord stimulation, plus everything else we discussed today?
There's actually a great website. It's called dpnrelief.com. Lots of great information on there.
Wonderful. And lastly, just let us know, Farrah, what type of advice would you like to give for someone who's living with DPN?
The advice I would like to give is that there is hope. Be persistent, and as Dr. Patel stated, go to dpnrelief.com to see if you can get information on providers that will be willing to go the distance with you from conservative measures to possibly getting that spinal cord stimulator if you're a candidate.
Yes, absolutely. Having that community of support is important. And again, that website is dpnrelief.com. Definitely visit there to find out more about this new treatment, as well as all the other information you need about DPN and how to set that journey forward if you're experiencing those symptoms or if you know that you're living with DPN currently. I want to thank both of you so much for joining me today. Thank you for sharing this important information. And Farrah, we wish you the best of luck in your journey.
Thank you. Thank you for having us.
Thank you so much.
Important safety information. A Medtronic implantable neurostimulation system is indicated as an aid in the management of chronic, intractable pain of the trunk and/or limbs. Implantation and use of neurostimulation system involves risks, including infection, paralysis, lead movement, pain at the implant site, jolting or shocking, and loss of therapy effect. For a list of adverse events that have been associated with the therapy, please refer to important safety information at medtronic.com/safety-neurostimulation. The medical procedure diathermy cannot be used on someone with an implanted neurostimulation device, as this can result in severe injury or death. Most electrical devices and magnets encountered in a normal day are unlikely to affect the operation of a neurostimulator. However, sources of strong electromagnetic interference, such as MRI and RF microwave ablation, can interact with the neurostimulation system, resulting in serious injury or device damage. Not everyone responds to spinal cord stimulation in the same way, and your experience may vary. To understand the benefits and risks, please discuss them in detail with your doctor. A prescription is required. For complete safety information about spinal cord stimulation for chronic pain, call Medtronic at 800-510-6735 or visit the Medtronic website at medtronic.com/safety-neurostimulation.